Welcome back, everyone, to TV5 News at 9. The newer GLP-1 weight loss drugs are becoming more and more popular. Results shared by celebrities have a lot of people wondering if these drugs are even a good option for them. Joining us this morning just to tell us a little bit more, we have Dr. Michael Kia, Medical Director of the McLaren Flint Bariatric and Metabolic Institute. Dr. Kia, thanks so much for joining us this morning.
Good morning.
Good morning. Okay, how do you go about determining which is a better option for your patients?
So I think that each individual plan is different for everyone. The new class of GLP-1 and receptor agonists and antagonists have proven in many studies to be effective for a number of patients. And typically when we're working with a patient for weight loss, we do a step-up approach. So we initially work with diet and exercise programs and then start to add available medications and then work with different avenues to improve their morbid obesity. Obviously, surgery is a component of the treatment of morbid obesity, especially with patients that have significant comorbidities like diabetes or heart disease.
So, Dr.
But each patient is an individualized approach.
All right, sounds good. Yeah. Can you weigh some of those differences and side effects with like a surgery versus, taking these types of drugs?
So as far as side effects go, the GLP-1 drugs do have a number of pretty well-reported side effects. I would say the most common side effect from those drugs is nausea and vomiting. The drugs work on the stomach to slow transit of food. That's their predominant mechanism. They also cause what's called satiety, which means a feeling of fullness. The nausea can be pretty significant, and actually the fallout or the number of patients that aren't able to continue the drugs is pretty significant and has led to a number of insurance carriers, especially here in Michigan, no longer covering the medication because of the difficulty with compliance with the medications. I would say overwhelmingly for about 20 to 30% of people, the medications work and they're able to tolerate the side effects of the medications, but a significant number of patients start and then stop the medications due to the side effects. Right. And although they do cause weight loss during that time period, some of the weight loss is due simply because patients are nauseated or unable to eat.
So losing weight is one thing, and then keeping it off is something that could be even more challenging. So can you tell us what kind of long-term data is there for drugs versus surgery?
So that's a really good question. And actually 2 or 3 really large trials have come out recently that still show that bariatric surgery is significantly more successful over any of the weight loss medications in a head-to-head comparison in terms of losing weight and keeping it off. And it's I think that now we're on our 3rd large trial showing that same outcome, both for weight loss as well as comorbid resolutions. The bariatric surgery, while not a 100% guarantee, the 10-year success rate for bariatric surgery is 80%, which is pretty significant. And for the weight loss medications, there really is no 10-year data. When you're looking at 5-year data, it's actually pretty low. Because of compliance with the medication and the need to continue the medication lifelong, because what most of the studies have shown, even the clinical trials associated with that, is once you discontinue the medications, for the majority of patients, the weight does come back on, and it can come back on pretty quickly.
So Dr. Kia, how can someone get in touch with the McLaren Flint Bariatric and Metabolic Institute, maybe to discuss some of these options for their specific case?
So we can be reached at 810-342-5470 or through our website at mclaren.org/Flint Bariatrics.
Dr. Kia, this has been great information. Anything that you want to add before we go?
No, I want to appreciate. Thank you very much for taking this morning.
Absolutely. Thank you again. And you can find more information through our hot links section about this topic on WNEM.com.